Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cutaneous innervation of the foot. Cutaneous innervation of the foot is very important to the medical students and medical doctors for the neurological examinations. The following cutaneous nerves carry sensation from the skin of the foot. These are the saphenous nerve, which carries sensation from the medial side of the foot up to the head of the first metatarsal bone. This is the area in the foot from where Saphenous nerve carry sensation like pain, touch, temperature. Dorsum of the foot, the sensation is carried by the superficial and Dfibular nerve. Superficial fibular nerve has more contribution. It pick up more area of the skin, the sensation from more area of the skin than that of the Dfibular nerve. The sole of the foot, the sensation is carried by the medial and lateral plantar nerve. Their common border passes along the fourth metacarpal and fourth toe of the foot. Sural nerve pick up sensation from the lateral side of the foot, including the heel. The heel area of the foot, the sensation is carried by the calcaneal branches of the tibial and sural nerve. Okay, first of all, we'll go to the Saphenous nerve. It originates from the femoral nerve, where in the femoral triangle it descends to the thigh, accompanied by great saphenous vein, passes anterior to the medial malleolus. This is the medial malleolus to the head of the first toe area. Okay, this is one of the longest cutaneous nerve of the body, the saphenous nerve. Okay, so we'll go to the cutaneous innervation of the foot here. Most of the skin of the dorsum of the foot is supplied by the superficial fibular nerve. This is the superficial fibular nerve. This is a branch of the common fibular nerve. Okay, it pierces the deep fascia and the distal third of the leg, becomes cutaneous and sends branches to the foot and toes. Supplies dorsum of the foot, all the toes except the lateral side of the fifth toe and first intertoe area. Intertoe area means the area between the two of the digits of the foot, and also the intervening area between the first and second metatarsal bone. Okay, so this part is the intertoe area. Okay, we got that. Dfibular nerve, a branch of common fibular nerve, passes underneath the extensor retinaculum to enter the dorsum of the foot, and this little part, first intertoe space or space between the first metatarsal, second metatarsal, first toe, great toe, this area, the cutaneous sensation is carried by the Dfibular nerve. Dfibular nerve is also a branch of the common fibular nerve, passes underneath the extensor retinaculum. We have extensor retinaculum here, inferior, superior extensor retinaculum, to enter the dorsum of the foot. This is the dorsum of the foot. Supply the area between the first and second toe. This is the first toe, this is the second toe. Cutaneous innervation of the foot, medial plantar nerve, lateral plantar nerve. Medial plantar nerve, lateral plantar nerve, these are the branches, terminal branches of the tibial nerve. Okay, this is the larger terminal branch, medial plantar nerve, supplies skin on the medial side of the foot. This is the medial plantar nerve area. Okay, and sides of the first three digits, 1, 2, 3, and the medial side of the fourth digit. Okay, lateral plantar nerve, the smaller terminal branch of the tibial nerve, supplies skin on the sole lateral to the line dividing the fourth toe. Is the fourth toe. So this is the lateral plantar nerve. This is the medial plantar nerve. Okay, sural nerve usually arises from the both tibial and common fibular nerve. Supplies the lateral side of the foot up to the fifth toe here. Okay, this is the sural nerve up to the fifth toe. Its area distribution is up to the fifth toe. Calcaneal branches. This is the calcaneal branches from the tibial like this, and from the sural nerve. Maybe some branch may come here or may not be in the old person, but usually there is contribution from the tibial nerve and the sural nerve for the cutaneous innervation of the skin over the heel of the foot. Okay. Calcaneal branches originate from the tibial and sural nerve. Okay. Supplies the skin of the heel, this part. Okay, we got that. And we have some clinical anatomy. Sural nerve graft. Surgeons sometimes need a piece of nerve to graft in another place. Sural nerve is a site from where the nerve graft are taken. Anesthetic block of superficial fibular nerve, that may happen. Okay, so it can be determined by telling the patient to do plantar flexion, and in a thin person it's possible to look at the superficial fibular nerve. We can inject it by local anesthesia and our surgeon can do the surgery. Plantar reflex is normally it should be plantar flexion of the toes. Okay, there is the plantar reflex. Okay, if this is done by the handle of the hammer by a blunt object, and it is stroked around the side of the foot and making curve to the great toe. So from the heel going laterally, returning to the medial side. That is the test for plantar reflex. If it is fanned out and dorsiflex, then it is a case of Babinski sign. So Babinski sign is like that. You can go there. Okay, you have to know that plantar reflex. We have to say Babinski sign here. Babinski. Babinski sign happen in case of upper motor neuron lesion, also in case of demyelination. Babinski sign. Okay, and this is the medial plantar nerve entrapment that may be entrapped under the flexor retinaculum or under the abductor hallucis muscle. And medial plantar nerve entrapment is found in dancers, in joggers. Sometimes it's called joggers nerve. Joggers nerve. Person who jog, they may have this problem. Not only that, and the person participating in dance, they may have this problem. Entrapment of the medial plantar nerve, maybe under the flexor retinaculum, or maybe under the abductor hallucis. That's all about the cutaneous innervation of the foot. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice day. Bye now.